Recording is now in progress. Would now like to welcome our first speaker, who is Dzaier. She's the chair of the Green Party's Disability Group and Co-Equalities and is a diversity officer on the party's executive, speaking in a personal capacity and a member of a SCAD steering group. Over to you, Dzaier.
Thank you, Rachel, and thank you to everybody for coming. Just a quick bit about me is, I'm spinally injured. I've been injured since the age of 9 months through a traumatic injury, and I've done many jobs, mainly in the social work area, and I've, up until quite recently, where I took early retirement, I've always worked. I'm somebody that has had to have social carer support, or I like to call them my facilitators. I employ my own facilitators, and I'm also on continuing healthcare. So I'm very fortunate that and I have a very comprehensive package. But one of the things that I have noticed on an individual basis, especially when at the moment, needing to maybe replace staff that have left, is that it's becoming more and more difficult to do so. We all have views on that. Brexit appears to be one of them, because a lot of people aren't able to come into the country. But for me, it's about the standard of people that you can employ. Because if you do it on a direct payment, you'll get given a much lower amount of money that organisations, whether it's through a local authority or health, it's much lower amount of money. So on an hourly rate, I actually get £13 an hour. And of course, you need to take some of that money back to pay for national insurance, etc., etc. It's quite complicated to have people self-employed. It is possible, but there's quite a complicated system. And I also use a payroll service, so that my carers, I just let the payroll service know, and then they're paid directly at the end of each month into their bank accounts. So I'm somebody that doesn't really want to be involved in all of the, tax and national insurance, etc. I employ a payroll service. But one of the things in terms of care is if you need specialist care, that's actually quite difficult to get. And as somebody spinally injured, I do need to have people who really understand my disability and, have an understanding when I could be in trouble and give me the support I need. Overall, in terms of care, it's quite clear with my personal experience. If I go into hospital, unless I go to a specialist spinal unit, the NHS actually can't deal with somebody with my level of disability, because actually, if I'm, say, in bed, I'm what I would call a beached whale. I need to have a lot of, I need help with feeding, I need help with turning, and the health service is just not geared up for that level of support of somebody. But yet we have a situation where if you're in hospital, you can find yourself in a situation where you lose your PIP stroke DLA, and on the basis that hospitals are able to care for you. I can assure you from personal experience, they have no idea in actually how to provide the appropriate care that doesn't put you into a worse situation than when you went into hospital. So one of the reasons I'm involved in this, because I strongly believe that care should be free at the point of delivery. And that is actually a policy that the Green Party have, which is actually our national policy. And, we actually are the most out there political party at the moment in terms of social care. Absolutely, people should be paid a decent wage for the work that they do. We also believe, and I believe, that the unpaid carers should not be given the pittance that the state gives them, with a caveat on that they actually have to do a minimum of 35 hours per week. So it kind of works out about £2 an hour. It's appalling. And we really need to make massive change. And I kind of are calling out to allies to actually support us as disabled people in making massive changes to the way care is distributed and how you get care in this country. But also the most important thing is disabled people or senior people, we actually need to be in the forefront of our care and care packages. It's important that we are the main voice, and that we need to, and what's happening at this moment in time, especially now that health and social services have joined together, care packages are being cut. What's actually happening is that they're using the medical model, which is not what disabled people support. Very few people nowadays are getting any support hours to be able to do things outside of just basically getting them out food. The whole concept of being an active member of society is being eradicated. And one of the things that I feel that we really also need to be calling upon is the professionals, including social workers, should not be there to be gatekeepers for the organisations that may be funding you. And that is very much happening at the moment. And I'm sure many of you see on Twitter, in the news, the realities of what is actually happening to disabled people and senior people. And I also remind people in many events that I'm at that actually we pay taxes to the National Health and to our government. At some point in our lives, we will end up with some form of long-term health condition and disability. That's just the fact of reality, because if we live a very, very ripe old age, it is likely that we will end up with something that is in terms of being aged. So we all at some point in our lives will be reliant on the care services that the country does or doesn't provide. So that's one thing. The other thing is, I don't think people understand that 20 to 25% of our population, it is a huge percentage, have a long-term disability or health condition. And I believe that when you add in carers, friends, family, the people who are affected by all of this is more like 40% in terms of the poor care facilities in this country. And, we've got to find a way of getting things changed, get our government to change things. And the other thing is 15% of the world population have a disability. And one of the legacies of the Tokyo Paralympics was, and it's called #WeAreThe15, was actually about trying to eradicate disability discrimination worldwide. by 2030. And, you know, I hope that we actually will succeed in doing that. Yeah, so, I mean, really, it's a hard time, but I think that we need to be being much more public, much more active about raising this issue in terms of social care, and what a disgrace it is at the moment for thousands and hundreds of thousands of people in this country. And I suppose coming from me is I'm actually saying, you know, help us do this. And we are an organisation that we're trying to actually make it a much more public debate. So yes, thank you.
Thank you so much, Dzaier. That was a really valuable contribution, and we're all so painfully aware as disabled people that there just is not the support out there for us to live our lives to the full. Our next speaker is Alex Longmore, who was a member of the Green Party Disability Group and lives in a residential home.
Can't see me, by the way. My camera's, I don't know where it's gone. It's withdrawn its labour. Yeah, I mean, just to add to what Dzaier has said, which is that, I mean, first of all, younger adults with disabilities are at least a third of all the recipients of social care, because in all the, you know, hoo-ha that comes out from politicians and the media, they talk almost exclusively about older people. And I think the quality of life for younger people of working age with disabilities has just so much deteriorated in the last 3 to 4 years. I mean, it's been going downhill anyway with the cuts in benefit and the raising of the bar with regard to social care eligibility, because that's constantly been raised. And the way the Care Act is used by so many authorities, I mean, I'm speaking as an ex-disability social worker, I'm now a brain injury case manager, but the way the Care Act is used, as is by many local authorities, they start from the point, now how can we get out of this? And they, you know, try and use all the elements of the Act kind of in negative perspective to find reasons why somebody should not quite be eligible for a service. And, you know, I don't know, you know, a special client who I'd worked with for a long time is now sadly dead. And I cannot say that her death is not unrelated to the fact that her local authority, when she moved house 2 miles down the road from one authority to the next, the former authority having supported her and given her, well, at least some of what she needed, local authority, second one, then assessed her under the Care Act and said, because her needs were unusual in terms of the brain injury that she had, and she had certain abilities as well as some very pronounced disabilities, they more or less said she was faking it. And they completely cut her off and actually never reinstated that. There was legal action going on at the time of her death, but they continued to fight this. The amount of money, I'd be interested to know actually, Dzaier, whether the amount of money that local authorities spend on trying to fight eligibility as opposed to meeting people's needs, because I think in many cases they actually spend more trying to fight off their responsibilities.
Thanks, Mike. That's a really valuable input, and thank you for sharing that. If we can just continue with the other speakers now.
Is Alex here, Rachel?
I don't think so, Don. I was going to ask you if you could, if you were happy to come
I'll
in.
pick up, yeah. And then maybe Alex, when Alex gets here, can do after
Yeah.
me. Okay.
Just introduce Don. Don is a disabled activist, author of the Lack of Care Act 2014, still available. Also treasurer and a member of the ESCAD steering group. Welcome, Don. Have you gone on mute now? There we go.
Yeah, someone muted me, sorry. Okay. You can hear me fine? Yep. Can you hear me okay? Yep. Okay, good.
Yes, thank you.
Okay. So the only fair deal for disabled people is one where adult social care is free at the point of use. Anything other than that just isn't fair. At the moment, service users are pitted against each other to fight for funds for a care package from a very small, limited budget. For all those who have the ability to self-advocate and get those extra pounds for their care package, there are many others who don't have the ability to self-advocate or have access to other advocacy and don't get those extra few pounds for their care package. This really is not fair. Adult social care has to be on the same footing as the NHS, where it is free for everyone. If we are going to get a fair deal and a free national care support and independent living service that works for all. Under the NHS, if you have a broken leg, an arm and a bruised finger, all these needs will be recognised and you'll be treated. Even if it means going on a waiting list for the treatment of a bruised finger, it'll be treated at some point. There's no needs assessment or no assessment to see if you're eligible. Under social care, if your needs, for instance, are being washed, dressed and meals prepared, but also you need help to go shopping and go out and visit family and friends, for many people who don't have the ability to advocate for themselves, only the basic needs are being met. The only sort of needs of being washed, dressed and meals prepared, whereas the other needs are not only just ignored, they're also not recorded as well. With a national care, support and independent living service that is free at the point of use, all need would have to be recorded, even if this need is not a need that is met immediately with funding. This data is crucial because just as waiting lists under the NHS record the amount of unmet needs at the present time, the data of unmet social care needs at the present time allows local authorities and governments to know how much extra money is needed in future budgets to fund that currently unmet need. Without that data, we just don't know how much extra money is needed for future years. Also, just as it's not okay in the NHS to not have all your needs catered for, in social care, it should not be okay to not cater for all of a person's needs. The NHS was started in 1948 without an extra penny overnight, and we could start a national care and support and independent living service that is free at the point of use overnight too. All that it requires is a policy change, a change of philosophy of how social care is run. Now tonight is partly about how do we get a fair deal, how do we get there? I want to point you to the work of the Campaign for Real Care and their Charter for the Right to Wellbeing, and I'll put a link to that in the chat afterwards. This charter in itself calls for a better deal for disabled people. This, I feel, is one of the necessary components on the journey we have to take to achieve a fair deal. Social care should join the NHS by adopting the founding principle of need preceding resource, and that should form the basis of a new constitution for social care. Currently, social care, unlike the NHS, has no constitution. The Charter also calls for the abolition of needs test, the abolition of eligibility. Just as in the NHS, this would create the conditions to transform the public narrative about social care from a negative one to a far more positive one. We all know that political resolve is influenced by public opinion, and it will be crucial to achieve a favourable public perception of social care before you get any political change. So what I encourage you to do, and I'll put a link in the chat, is back the Charter for the right to wellbeing and also promote the Charter, because I feel this is a necessary step if we're going to achieve a national care and support independent living service. Back to you, Rachel. Thanks.
Thank you so much, Don. I'm just have a look and see if Alex has appeared. I don't believe so.
Sorry, I'm on the phone to Alex at the moment. Somehow he's got the wrong link, so he's trying to sort it out. So why don't we carry on, and then maybe when he does appear, give him a slot, if that's okay.
Yeah, that's absolutely fine. There. Our next speaker is Helen. Was going to be Helen Rowlands, who works for Inclusion London. Unfortunately, she's unable to attend at very short notice, but she has shared with me the briefing that she was going to share. So I'm happy to present that to you now. Inclusion London, supporting London's deaf and disabled people's organisations. This is about charging for care. Charging for care pushes disabled people into dire poverty. The social care means test looks at both capital and income. Therefore, people without assets must still pay out of their income towards the cost of social care support. Pensions, mean tested benefits and extra cost benefits such as personal independent payment, disability living allowance, attendance allowance are regarded as income in the social care means test. The Care Act and charging regulations give local authorities power to charge off and often take away welfare benefits designed to pay for the additional costs associated with disability, to pay for social care support via social care charges. The reforms introduced by the Health and Care Act 2022 only make changes to capital means tests. Those changes will have no impact on people who are assets poor. This includes working age disabled people. Therefore, in order to protect people with the least assets, the radical reform to income means test is needed. The problem: disabled people with the highest support needs and no assets can be forced to give up to 40% of their benefits income to pay for basic care needs. This situation significantly disadvantages younger disabled people with high support needs, and those who are, for other reasons, cannot work and are not able to supplement their income. Having to give up their disability benefits for the essential support they need to live a normal life is pushing them into deep poverty. In the current environment, with costs of energy and essential goods rapidly increasing, disabled people who are entitled to statutory social care are now confronted with an increasing impossible choice between keeping essential statutory care or covering basic living costs, including energy costs to heat their homes, power their essential equipment such as wheelchairs, ventilators, and putting food on the table. More and more disabled people are being pushed into debt as a consequence, with recent analysis carried out in spring 2022 identifying around 90,000 social care users who were already unable to keep up with their care contributions. And BBC investigation found 60,000 people were chased for charging debt. This is a debt that many cannot afford to pay. Moreover, we increasingly hear about the cases where local authorities threaten to stop support, or are forcing people to go off direct payments, as I was talking about earlier, and accept support options which are not best for them because of charging debt to force people to agree to a repayment plan. I'm in quite a small area, and I did a freedom of information request on how many people are charged for their debts, and it came back at over 2,000 people. So that's just looking at sending bailiffs out for them. The minimum income guarantee. The Department of Health and Social Care sets out the minimum amount that people who pay for care should be left with. This is called the minimum income guarantee. Minimum income levels remained frozen since 2016 to 2022 and lost more than 20% in real terms value since then. There is no statutory duty on the Secretary of State to increase minimum income levels in line with inflation. Minimum income guarantee was increased by 3% in 2022 and by 10% in 2023, but this nowhere near compensates the real terms loss in value. There has not been any assessment as to whether the minimum income guarantee level is enough to meet basic living costs of disabled people. There is no statutory duty to increase minimum income guarantee in line with inflation. Moreover, because minimum income guarantee remained frozen, people who pay for care out of their benefits did not see any benefit increases to means tested or disability benefits. An increase was taken by local authorities as the care contribution. Due to funding pressures, an increasing number of local authorities are asking people to contribute. All income above the minimum income guarantee between 2019-20 and 2022-21 alone, local authorities recouped an additional 45.6 million from care users. Disability-related expenditure. I also have examples of this. Disabled people who pay for care out of their extra cost benefits can retain some of their benefit if they can prove their disability-related expenditure. The system of claiming disability-related expenditure is complex and inaccessible and unworkable. Can you believe that? In reality, only a few are able to claim this money. We believe it is wrong to ask people who have already been found eligible for extra cost benefits to prove a second time that they need this money. It also creates inequality between those disability benefit recipients who do not receive social care and are free to spend their extra cost benefits as they wish, and those who do. We want disabled and well people to get good social care support, which enables them to live a normal life. No one should have to sell their house to pay for care. However, it is equally essential to ensure that those who are poorest are not pushed further into poverty because they rely on social care support to do the basic things in life. In the long term, we believe social care support must be free. NHS helps us all to be healthy, and social care helps thousands of people to live a normal life by removing barriers people face when doing ordinary activities. Charging for care is a tax on disability. In the short term, income means test must be reformed. Extra costs, disability benefits such as pay, DLA and attendance allowance must be excluded from the means test. Those benefits are not meant to pay for care, and it is illogical to have a situation when those who have a higher support needs and receive social care are effectively forced to give up those extra cost benefits. Minimum income guarantee must be increased significantly, at least by 25%, to ensure disabled people have enough money to live on. There must be a statutory duty on the Secretary of State to review and increase minimum income guarantee levels in line with inflation. In the cost of living crisis, local authorities should not pursue debt recovery action against those disabled people who are not able to pay for care. Just got a couple of case studies that I want to share with you. Elizabeth lives in West London. She gets 10 hours of support from social services per week. Elizabeth has complex needs and is on ESA support group and PIP, the highest rate of both components. Last year, her local authority changed its charging policy and her charges for care went up to £150 a week. Her local authority only leaves people with the minimum amount set out by the national government, which means Elizabeth has to live on £156 per week. PIP is sold as a personal independent payment, but it is anything but if individuals are not allowed to spend it on meeting the costs of their disability. Polly lives in London. She has high support needs and has been receiving support from social services since 2001. In this time, she has employed her care workers through direct payments. She also received money from the Independent Living Fund. The council have increased my charge to more than £90 a week. I can't afford it. For the last 8 years or so, I have had to get loans out to buy wheelchairs that the NHS wheelchair service refused to supply. My latest loan costs £189 a month. Paul has learning difficulties. He lives in London. 5 years ago, the local authority agreed a care package for Paul. They did not communicate in an accessible way to Paul that he would have to contribute to his care. Over time, Paul's debt grew and it stands at over £10,000. When he found out Paul stopped his care completely, he could not afford to pay his contribution. This is the reality. This is what is happening daily. I can add one to that of my friend who was on 15 hours of care a week, and it got cut down to 10. Her needs haven't changed. She's also being chased by the council for the costs, and this just can't go on. Thank you. Dzaier, have you had any update?
No, I haven't been able to. I forwarded on an email which should have the link, but I haven't had anything. What I'm happy to do, if people to give Alex's story, because it's actually Alex is in residential care. If people are happy for me to give that story on behalf of Alex, who's not here.
Yes, I would say so. Yeah, go ahead,
So,
Si.
Alex is in residential care, and basically Alex's story was he has MS, and it was quite progressive. He has a now 18-year-old son. When he was his son was 8, his home had got to a point where he couldn't use the home, couldn't use the bathroom, was having to sleep on a sofa. And so what actually happened to Alex was that it got to such a point that he just couldn't cope at home, and his wife was struggling to support him as well. He'd made a request for buildings works and adaptations to be made to his property, and basically the local authority for funding were very slow at coming forward. So what was Alex actually hit rock bottom through his mental health, and it was suggested to him that he could go into residential care for respite. 10 years later, Alex is still in residential care, because what actually happened was, after a month, and of course, one can understand that when you're in an environment that can meet your needs, you feel a lot better. And what was put to him was, well, this is most probably the best place for you. So he feels, and having spoken to about this, I kind of feel that he was hoodwinked into going into residential care. He really would love to be at home with his family. And these are the things that he's lost. He's lost being able to parent his son. He's lost his relationship. He's lost his home. And during COVID, he lost all connections with his family, because of course, his son was allowed to come stay overnight, but that all stopped. He had no connection with any family whatsoever. I'm also aware during the period of time after 2021, 2022, there were situations in his residential establishment where members of staff got COVID, or some residents got COVID. And what the home did was they put the whole home into lockdown. And I know of situations with Alex, where Alex hadn't been out of his room, apart from going to the communal bathrooms, for a month. Even though you and I were able to wander around in society, you know, to meet people. He's also, over the COVID period, he was using oxygen therapy in terms of disability. During COVID, he had none of that. Well, had he been living in the community, he most probably would have been able to get that treatment, especially. Even today, his situation is that he's asked to be able to have some funding so he can actually, you know, be with his son, who's now 18, an adult, outside of the home. And he's now waiting for social services to decide whether they will give some financial funding for him to be able to get a taxi to meet in town. He's not able to drive. He doesn't have his own vehicle, so he's absolutely reliant on either using taxi services or trying to book the residential home situation. He informed me today that the home that he is in was run by Sue Ryder. They have now decided to no longer be running the home, which is especially for people with neurological disabilities. And an organisation called has come in who runs homes, but it's for people with brain injuries. He is a resident, was not asked what he wanted. He was just basically told this is what's happening, and that they will do the best to provide the appropriate services that he needs, and will listen to the residents. We today talked about the implications of that may be for. So, for example, if they have a new resident who has head injuries and their behaviour, they're physically able, but their behaviour could be quite active, possibly violent. If Alex is in bed or not in his electric wheelchair, he will be in his room as a sitting duck. And there were many residents in this home that would be in that same situation. And of course, as a resident, he has no rights as to saying, you know, this is what I need, you know, this is what I want. So one of the things that highlights about being in residential care is that you actually have no control over what happens to you. You know, organisations buy and sell residential homes, and basically the residents in their residential establishments. And we have to understand it is their home, and maybe going to be their only home. They are commodities. They are financial commodities with no voice at all. So that's Alex's story, which is, for me, as a fellow disabled person, I find that really harrowing. Thank you for allowing me to tell you his story.
And typically I'm here now.
Oh, well done, Alex. Go, say your bit there.
So, anyway, as I probably told you, I was retired out of the police due to my multiple sclerosis, and I went to an old people's home purely for respite when I'd had a infection. But then I was given two choices by my social worker at the time, and we went to look at one, and it was depressing beyond belief. So we went to the other one, which is the home I'm currently in, which is the Sue Ryder home, Stagan home, and totally different atmosphere, and it all seemed good. So I started coming here for respite, and then was offered 4 weeks respite here. So I'm like, okay, I'll go with that. At the end of the 4 weeks, the social worker says, you can stay if you want, this can be your new home. I decided to sleep on it at my old home in Welling Garden. Luckily I did, otherwise I'd have been charged for the 4 weeks. But I just sneaked out of that. So I then became a resident. And there's been a lot of changes since. Most notable one that's ongoing at the moment is that Sue Ryder have done a big reassessment of all their bits, and they decided they can no longer handle neurological care and put it out to tender for any who would be willing to take it on. That has been taken on by the Disability Trust, and I've been to a meeting with them, which didn't fill me with dread, but you still feel really powerless in a lot of things, because these decisions were made by the higher ups within Sue Ryder, and we didn't get to really say, but I don't want to go with them, I want to stay here. But we are staying here. No residents are being moved out. So best I can hope for. Despite my family only being, I'm trying to remember how far it is now, 15 miles or so away, if that. But because the social services couldn't see a way to make it accessible for me to get around the house, they decided you get to go into care. I've been laying here thinking, well, we could do this, this, and this, and that would be fine for getting around. But I missed my chance. Not that much more I could say. Have I missed anything?
Rachel, then?
No, thank you for sharing your story, Alex. As I had also shared it prior to you coming in, but it's lovely to hear from you. I'm sorry you had trouble getting in.
Yeah, it's my own fault for not organising things. I will now learn to be more prepared.
It happens to the best of us. Don't worry about it.
Well,
Claire, can I take you?
much.
You're very welcome, and thank you, Alex. Claire, can I take you when we've gone through the remaining speakers? Won't be long. Right, the next speaker was going to be Andrew Gwyne. Unfortunately, he's been called away to Selby to campaign for the by-election and is unable to attend. However, I do believe he's sent some share this statement with Jackie if she would like to come in.
Yes, thanks very much, Rachel. Just to say, as a little bit of background, first of all, Andrew Gwyne has pledged his support to the End Social Care Disgrace campaign, and it is unfortunate he can't be with us tonight. I am a member of his constituency and a member of the Labour Party, and the End Social Care Disgrace aims have been submitted from his constituency Labour Party to the Labour Party Policy Forum, and he was adamant that that should be the case. At a meeting with us, he expressed the view that the needs and desires of disabled people should be listened to, and a national care service must involve true co-production. He did say that he wants to put the social back into social care. He's recently announced that acknowledged that the announcement of the government-backed plans to permanently close railway ticket offices is causing significant concern. And he said that not only will this decision cost jobs and livelihoods, it will make railway stations less accessible for disabled and vulnerable passengers. He will be making a submission to the government's consultation and fighting the decision tooth and nail. He does want an inclusive society. He sent this short statement as well, saying that I know from my work as Shadow Public Health Minister and lead for immunocompromised and clinically vulnerable people in the health team, just how important it is for disabled people to receive the care they deserve, whether it be primary care, mental health support or social care. The health and care system has been pushed to absolute breaking point, and it is older and disabled people who are paying the price. We cannot build a better Britain with decent public services and a growing economy unless we tackle the issue of social care. I'm therefore grateful for the work that End Social Care Disgrace and others are doing to raise awareness of the problems in social care, as well as campaigning with and on behalf of disabled people. For the last 13 years, social care has been totally neglected by the Conservative government. That must and will change under the next Labour government. And that's his message. Thank you.
Thank you, Jackie. And our next speaker was also going to be Rebecca Long-Bailey, but unfortunately she has been called away on constituency business. In my years of dealing with MPs, this happens quite a lot. So without further ado, is Claire still there from Invisible, and would you like to speak now or ask your question?
Thanks, Rachel. It was mainly a comment on the situation which Alex Longmore was describing. Well, thanks everyone for your contributions, all very important information. That Invisible is we're also dealing with similar things. Just on the right to family life, wanted to mention that the Care Act Section 12 includes assessing the needs of the family, not just the individual, and relates to disabled mothers and disabled fathers as well. And we're pressing for councils to provide resources under the Care Act and the Children Act to support disabled parents, especially mothers, instead of the enormous spending on child protection measures, because a child or young person having a disabled parent is...
So you want to do the hours thingy?
Excuse me, Harriet, can you just put yourself on mute, please?
A child or young person having a disabled mother or being the carer is seen as future harm that the child has to be protected from via fostering or adoption. And anyway, we're fighting that, and on Wednesday we're launching a Charter of Rights with 5 demands, which also cover the family courts. So when the chat goes on, I can put a link to the event in the chat, and also we would like to invite End Social Care, Disgrace and the connected organisations to endorse the charter if you agree with it. But I just wanted to raise that it is possible to do a legal challenge on the right to family life where this separation is happening. Thanks.
Thank you, Claire. Yeah, that's very important, and yet when the chat should be going on shortly anyway, so if you can just drop that in the chat, that would be very helpful. Thank you. I think Maggie was next.
Thanks very much, Rachel. Firstly, so Maggie Byrne from Ealing Reclaim Social Care Action Group. Just first of all, wanted to thank all the speakers. That I think that was very, very moving, some of the presentations, and again reminded you of how much this campaign is needed, and we need to raise the profile of social care publicly. So just a request afterwards that, you know, the recording and even some of the presentations, if they're available in script form, would be useful to circulate so that we can then forward on to the people who weren't able to come, especially the politicians who weren't able to make it, or other politicians that are sympathetic to the agenda. I just really want to pick up on a very small point, but I wanted to say thanks for the initiative and all the organisers. But I wanted to pick up on a small point that Don raised, and which has been something which our group raised some time ago, but kind of let it a bit off the agenda. He raised the issue about unmet needs, and the value of at least recording the level of unmet needs. And I thought the parallel with waiting lists in the NHS was a very good one, you know, that people are really aware of how important the NHS is when they understand, you know, both the length and the number of people involved in waiting lists, whereas social care is often a very invisible issue for the general public, and therefore getting a better sense of what the unmet needs are. And just to alert you, we raised this early on in our work with the local council, and the answer was very, very interesting. We asked if the council was maintaining a record of unmet needs, and the answer was, under the Care Act, local authorities are legally obliged to meet all eligible need. So for that, interpret it to mean we cannot record unmet need, because otherwise we would be found legally in violation of our duties to meet, you know, eligible need. So it's something that's kind of gone a bit off our agenda, and we weren't quite sure how to handle it anyway. But I just wanted to pick up, as I said, it seems like a small point, but I think it's quite a telling point, and one that now, in light of Don's remarks, I think we might want to go back and revisit again. But thank you for everyone else's contributions.
Did you want me to respond to that briefly, Rachel?
Yes, thank you, Don.
Yeah, I mean, I think Maggie's right. Essentially, council shoot themselves in the foot. They ask for more money. They all say we need more money, but then you ask them more. But they also say no, we've met all needs, and they have an argument to say we've done everything we need to do, and yet we're short of money. So it really is important for councils to. I mean, it's partly also what Dzaier was saying, essentially that social workers act as gatekeepers for the local authority, and what the social workers ought to be doing is recording all need, even need that they aren't going to fund immediately, and then local authorities have to be upfront and admit, you know, even though they're meant to work according to the Care Act, just maybe admit that they can't because there's not enough resources, and actually record that unmet need and make their argument stronger. But by saying they meet all need, but we still need more money, it just goes round in circles and they shoot themselves in the foot. So it really is a really big argument, and we really need to get that out in the open, really.
Absolutely, thank you, Don, and thank you, Maggie. And I'd just like to thank all the speakers also. We would like to open up for a bit of discussion now, because we would like, it's, you know, at the end of the day, it's about civil people, and we need to we wanted to hear your input. Thank you to all the attendants that have attended. There's a very good participants in the room. I'll take Charlie next. Mike, I'll just hang fire for a minute because to give others a chance to speak. Thank you. Thanks, Don.
Hi, sorry. Yeah, just to follow on the conversation about unmet need, I'm part of the Campaign for Real Care that Don's been speaking about. And what you were saying, Maggie, about councils basically saying, oh, we are legally obliged to meet all eligible need. What they fail to admit and don't deal with is the fact that they actually have a power to meet need that's over and above the legal duty to meet need. And actually in the Care Act, the legal duty was supposed to be a minimum guarantee, not the total offer. And the power to meet need should make up most of what people actually get. So much more like the NHS, where you have a kind of the blue light services. And then above that, you have...
So I'm trying to mute this, but failed.
All right, we good. Sorry. Yeah, so you have the blue light services with the NHS, and then you have the most of people's needs met, health needs met via waiting lists, and waiting lists grow and decrease according to political will. Whereas with social care, there's literally nothing to push political will to actually push for basically unmet need, because there's no record of unmet need. So yeah, I think it's a really important thing to look at. And actually, if we can get the unmet need data, it's going to provide a huge amount of powerful data for us to campaign for the National Care Service, rooted in an understanding of actually how much unmet need there is. Thanks.
Thank you, Charlie. Thank you for that. Dzaier, did you want to come back on that one as well?
Not totally. What I just wanted to come on is, so tonight we've talked a lot about paying financially for care. There's one local authority in the country, because actually there's a massive misunderstanding again, is the law states that a local authority has to do a financial assessment. But what the law does not state is that they have to financially charge you. And there's one local authority in the country that actually doesn't charge care for care. And I think you'll find that in 2024, Tower Hamlets, they're both in London, Tower Hamlets is about to do the same. What we don't know is whether they are going to make, raise the bar for need. But there is one local authority, and I think it's Hammersmith and Fulham, and Tower Hamlets are about to do the same in 2024. So really, another thing that we can be pushing through our contacts, etc., is to actually get local authorities to just not charge.
Exactly. Kalichi.
Hi everyone. Yeah, thank you for all the speakers. It was really, personal to me, everything you said. Just wanted to comment on what this Dzaier said and Don, about the for me, there was time I was admitted in the hospital for 3 days. I had a little surgery, and after that 3 days, because of the complexity of the surgery, I was told that I have to have a carer overnight. And I said, okay, you have to call, I told the hospital, you have to call the social services and let them know so they can arrange for my carers to stay overnight. And when they called the social services said, oh no, Kelechi's package does not include night stay. But according to the nurse said she explained to them that see what she has gone through in the hospital, and we discharged her, and we are scared she can't stay on her own throughout the night. It's just for 24 hours, just that night, that's all. And I was refused. Social services still declined to give me some carers. So the hospital like, okay, we've discharged you, we can't put you back in the hospital. We have to keep you in the waiting room and just monitor you because of the injection we've given you and a medication. We just monitor you for some hours. And I was hungry. And because I was not an inpatient, I was not given food. They just gave me a cold sandwich to eat. And I've not eaten because of the surgery. I didn't eat. I had to not to eat for 24 hours. I was told not to eat for 24 hours. So I was hungry. After the surgery, I had sandwich. Then when the morning when I was discharged, nothing to eat, I was so hungry and I was there. It really, really hurt me a lot. And finally, I paused them. I told them, please, I want to go home because there's no need. They're not keeping me. Social service is not helping me, and I'm just here. So that one apart. Then another scenario that happened was I had to have hydro where you swim in the hospital. Oh God, sorry, I'm trying to get my words again. Where you swim in the hospital because of my spinal cord problems. And they said, okay, the hospital was like, you have to hydrotherapy. The hospital said you have to tell the social services to give you a carer to be able to join you in the pool. I called the social services and I said, please, can you give me a carer to change? It's just once every week. And it's 1 hour appointment just to help me out. And they bluntly refused it, and that really, really just went into this, like, I begged for it because I told them I can't miss this hydrotherapy because I'm in pains. And they refused it. And I still had to go. I had to manage myself. The hospital couldn't give me anyone to help me because they said it's not in their power to do it. This is something that we need to reconsider. This is what's about these care charges. Is like, then coming to my care charges, that one is another question altogether. I get 2 carers. And now because my care charges are too high, I have to, I'm thinking, should I remove 1 carer or should I even stop the carers at all? But I need the carers. And I have to have 2 carers because I'm susceptible to falling. I fall a lot, So
to just ask you to wrap up now, if that's okay. Thank you.
Yeah, thank you.
Tony.
Thank you. Thanks, Rachel, and thanks very much to everybody who's spoken so well and movingly. Can I just ask Charlie and Don if they know of any comparison of numbers of disabled people who've had an assessment of need by local authorities, and if not, whether it's worth considering an FOI campaign to get the levels of need, so that one answer to the fact that the local authorities can't declare unmet need is to compare levels of need in an area where it's better recorded. That may be a little bit tortuous, but I was just wondering,
yeah, the problem is, Tony, no local authority in the country is recording unmet need, because what they're doing essentially is say that at the same time, like Don said.
I didn't mean that, Charlie. I meant the level of met need. If you could compare the level of met need, for example, if incomparable local authorities, one area had twice the level or 3 times the level of met need, then that's an argument that the other authority is falling down and neglecting disabled people.
The campaign, as part of our campaign, we've got some reports that people might find they're quite arduous to go through, but there's some really important information. We've done a lot of research in the borough that I live in, which is High Barnet, and we've discovered a lot of kind of information about what's going on there, but also we're doing some research around the amount of spend per service user and the disparities across different local authorities. And actually, a very interesting piece of information that came out of that is that no matter how much money is spent, the outcomes are no better. So this suggests that they're just meeting whatever needs they think are eligible, but they're not actually the needs that people identify for themselves. So there's a huge misspend of resources. And yeah, it's like somebody mentioned earlier about how much money do they spend fighting people that are trying to get what they need versus actually spending money on the needs themselves. So we've got this, it's part 3 of our report called Unveiling the Truth About Social Care. And that should be coming out shortly, probably within the next couple of weeks. But we'd be happy to share that with everybody here.
Thank you, Charlie. Is that okay, Tony?
Yeah, thank you very much. Thank you.
Thank you. Do you see? Have I pronounced that right?
Hi. Can you hear me?
Yes, thank you.
Hi, I'm Josie. I am actually working for the social care, community support, and doing rest assessment. I have no idea if what we do in Suffolk is the same as in any other councils. NHS and the social care has different funding. NHS was funded by, obviously, the central government, whereas social services was half-half. And when it comes to kind of needs, if like, I can't remember her name, the one that just says that she went to have that operation and she can come home because of no support. In Suffolk, if, you know, in the situation in her case, normally we have the NHS as a REACT team. They are the one that supports the community. If obviously social care cannot pick up. But as far as I'm aware, REACT team is not doing a sleep-in as well. What sleep-in, who does sleep-ins are the those that needs like the Macmillan and what is the other one? Mary Carey. If you are in that stage then, but not when somebody was coming home from the hospital. They just have the REACT team to follow them up.
Not good, is it?
No, no, not at all.
Thank you for your contribution. I think Anne was next.
Thank you. Just briefly on the question of unmet need, with regard to older people, the over 50s, there is data from the English longitudinal study of aging, which comes out every 2 years or so, about the kinds of tasks that people need help with and what they get or don't get. And this is analysed in a very sort of global way by Age UK, who do annual reports on it. So for over 50s, that is helpful. I'm sure there must be some government survey that deals with disability-related needs of younger people, but I don't actually know which one it is for the moment. It might be something like Understanding Society. I mean, I could look and find out if people are interested.
That would be interesting, yeah.
Yeah, and I think, sorry to jump in, but I think there are stuff, but none of these reports correlate with any of the reports that come out from local authorities, because they all say that all need is being met. So that, you know, basically these are kind of arbitrary figures taken from surveys, But the reality is that most local authorities will have come across a lot of these people, but they're basically just turning them away because they're saying they're not eligible. So, you know, it's a massive scandal that needs to be publicised.
Thank you, Charlie. I think just for the next sort of 10 minutes, we need to kind of look at what we can do to move forward with campaigning for this. So if anybody's got any ideas, then please do share them with us. I believe Jane was next.
Oh, right. Okay. Yeah. I just wanted to ask the question that I put in chat. I'm a full-time carer to 2 adult sons with autism and learning disability, mental health needs, who live at home with myself and my husband. And we've had various care assessments for our sons. And I finally had an up-to-date carers assessment recently. And what I'd really like to know is there any way of recording unmet need anywhere that's already been assessed as being eligible within the assessments? Because, you know, that would actually increase your right and your weight as a, you know, your voice as a carer, if it was, you know, reportable, you know, without going down the legal route, because then, you know, it would actually be down there in black and white. Is there anything you can do other than writing emails to managers and directors and whatnot?
We've got a toolkit.
John, did you just want to come in?
Yeah, I mean, one of the issues is that the way local authorities assess you is not really in conjunction with the Care Act. They, even though the Act's been here for many years, they still assess you under their own methods. And I think ideally what you ought to do
What
is...
you mean local methods?
Authorities, yeah. They kind of ignore the Care Act and just assess you under what they view as eligible.
Right,
so,
okay.
If you go to the link I put in the chat about the Campaign for Real Care, there's also a toolkit there where you can do your own self-assessment, which is linked to the Care Act, looking at the 9 areas of well-being, and you could use that self-assessment and give that to the social worker. Or if you feel you're self-assessed and what you're given is not what you've been asked for in that self-assessment, then the actual data you will have there is the things that they won't fund you for. Because I mean, your self-assessment under the Care Act, you know, the service user is viewed as the expert in what their needs are, and so they ought to really use that self-assessment tool, that self-assessment as, you know, as being the main thing from which they should fund the care package. So I think if you do your own self-assessment, and that might help you, and then you'll be able to understand how much they don't actually fund and how much the gap there actually is.
Right, yeah. I mean, quite often it just gets repeated and regurgitated in different form, but only, you know, with the same things not having been met, etc. Not necessarily wanting to go into loads of detail, but you know, it's just quite a frustrating process.
So if you check the chat, there's in the toolkit
Okay.
now. But essentially, you're almost starting from a bad place anyway from the way they assess you, because they're not really working with the Care Act. They're really curtailing how much they would want to give you from the way they actually assess you.
Right. Okay. I can see what you're saying. Right. Thank you.
Thank you. Thanks, Jen. Thanks, Don.
Thank you.
Yeah. I'm just kind of. I'm wondering if I've fallen over yet another piece of information that I didn't have at the beginning. 18 years ago when I started, sorry, 20 years ago when I started looking after my daughter. There's a duty of care on local authorities to meet assessed need. And we know that they're not doing it because they assess to meet those rather than to meet the need that's required. But is that same duty on the NHS when they're assessing for continuing care? Because I've been through a very thorough assessment, which I suspect probably matches in many ways the documents that Don and Charlie are talking about at the moment. And the result of that from the ICB under continuing care was to say to me, well, if anything happens to you or your husband, then your daughter will be taken into hospital to be looked after. And we've already had from Dzaier, you know, the fact that people, my daughter has a very devastating neurological illness. She cannot move, she can't talk. She requires 24-hour nursing care. And there is no way that hospitals can look after people in Sarah's condition. I've always had to go in if she's ever had to be in hospital for any length of time. I've been there with her. And it's like, is that care, is that responsibility, legal responsibility placed on the NHS as well as local authorities? Because that would be quite an interesting one to pursue, and certainly another very good reason for a national care service, which is not under the NHS or the local authorities.
I would say, Jo, that those needs would be met under the Care Act via social care. So it would count as additional care within a hospital stay. So if your daughter needs extra support if she's in hospital, then that would be covered under the Care Act under her specific need.
Sorry, I think you're misunderstanding, Charlie, but the
sorry.
idea is that if I die,
right,
they're going to take Sarah into hospital because 24-hour nursing care is too expensive.
Right. So, but her needs would be the same. Her needs would be the same regardless. If she's taken into hospital, she still needs the same level of support. So she would still be eligible, and there would be a duty to meet those needs. And if the hospital can't meet the needs, then that's not legal.
But that's the point, isn't it, Jo? That they're not prepared to do that. And I read an article earlier on that Claudia Webb had written around integrated care, and to me that's where this comes into it, because it's part of the package, it's part of the full package. So there's still got to be that responsibility across both organisations. I'm conscious that we're running out of time. I'm just going to take Nikki from DPAC, and hopefully we might be able to come to the others that have spoken previously before the end. Thank you.
Hi, on the question of what we can do next, I was very, very moved by the video that Social Care Disgrace put on their Instagram in the last few days, and I wonder if we could do more of the same, have short videos telling people individual stories and try and work with other organisations like People's Assembly Against Austerity and DPAC and other campaigning organisations to share these stories so that more people understand what's happening, because so many people would probably care if they knew and understood what people are really going through in their day-to-day lives.
Thank you, Nikki. Yeah, that's really important. We've only just started the Instagram, and we've also started a TikTok as well over the weekend, because that video actually popped up on TikTok, and I saw it and was absolutely devastated. I have managed to get her in touch with Dawn. Oh, why's her name just gone? The MP for Brent, Dawn Butler, and because she's her MP. So hopefully Dawn is going to deal with it, because I've spoken to Dawn. But yes, I think that's a really good idea. And if anybody would like to just do, I don't know, 60 second, even just a 60-second video, or because they tend to get a quick hit, just explaining what you're going through. And I'm sure we're happy to share it on our social media. Thank you, Nikki. That's really important input. Dzaier.
Yeah. Two things. One is just responding to overnight care. That's actually not true. People do need to have overnight care, but don't necessarily have to have somebody live in. For example, somebody like myself needs turning at night. it's cause us sleeping. It's quite useful to look at. The thing is, you tend to get what you want if you know what the rules are. So, for example, I have a very, very comprehensive care package, and I'm really lucky for this. I've had it since I was in my 30s. One of the reasons I'm very lucky was because there was a court case with regards to my disability is tetraplegia, quadriplegia, and there was a court case, and actually anybody who is looking for care support and has tetraplegia or quadriplegia, there is basically a precedent set in terms of that disability because of the court case. And that's again how I managed to, in terms of CHEC funding and local authority funding when I had it. The other thing I just wanted to quickly raise is that in social care, we, with other organisations, are looking to have some street action in terms of raising the issues of social care in London. And we would absolutely love people to contact us if they're really, if they're interested in supporting us or helping us to get the word out so that we can, so that we can actually make this happen. We're looking at the moment, but we're still in the development stages, but September, but we need help with, graphics. We need help with getting the message out. So it's really a call to all of you wonderful people who've turned up to this event is, if you are interested in supporting us to actually make it real for society and real for government. So this is likely to, the event is likely to be happening outside of Parliament on Prime Minister's question time. We have to look at how we're going to do it legally and stuff like that. But that's what we're looking to do, some action. But we're desperately in need of people and connections with organisations and just people's help. So yeah, thank you. Is anybody able to put it? I'm not able to, because of my dexterity, to put into the chat how people can contact us. Could somebody put
I'm just going to go through that now. Di, thank you ever so much for your contribution, and thank you to all the amazing speakers tonight as well. I know we got we had to muddle through, but I think we've muddled through quite well. Thank you also for the input from the guests. And as Dzaier says, if you would like to join us, we have various working groups. We have a carers working group. We're hoping to set up a disability working group. Anything that you've put in the chat will be saved, and we'll be taking the details. If you would like to drop your emails or your contact details in the chat, if you would like to continue to support us. And as I said earlier on, our next one will probably be in the autumn, talking about care and support workers. I'm sorry for anybody who I've not managed to get to, but I think we've got some good ideas to move forward with. Again, if anybody wants to submit a video with their story, then please contact us via email on any of the social media channels. We're on Facebook, Twitter, TikTok and Instagram, where messages and DMs are open. And hopefully we look forward to sharing future campaigns with you. And please do look out for our next event in the autumn. Thank you everyone for attending, and goodbye.